Good afternoon. I want to welcome you all here to our presentation for MIS Information Systems and Strategy, our group project brought to you by Autumn Carly Gavant, Jonathan Niddle, Brett Lombardi, Sullivan Menard, and Elizabeth Nelson. So, I want to start out with an introduction. Artificial intelligence it's rapidly changing many aspects of business, and particularly the healthcare sector. There's a lot of areas where it has the ability to change and improve systems and impact the entire system for patients, for providers, for administrators, and hopefully can increase the efficiency and effectiveness of the entire system. I want to start out my section with a bit of a story. Every day in hospitals, a troubling pattern emerges. Dr. Sarah spends more time documenting care than actually providing it. Nurse Michael manages multiple patients but spends only 1/3 of his shifts at their bedside. The rest is consumed by charting, phone calls, and endless administrative tasks. This isn't an isolated problem. It's become the norm, contributing to widespread burnout among the very people we depend upon the most. 62% of nurses have reported burnout, and medical errors claim many lives annually. So our current approach is currently failing both the patients and providers. Hospital staff are interrupted constantly during their critical tasks, spending twice as much time on documentation as on direct patient care. This broken system exhausts our healthcare heroes, and it threatens the quality and safety for everyone who relies on hospitals for their care. And so AI has the ability to hopefully reduce some of this inefficiency, uh, take down on some of this administration tasks that are hindering our physicians and our healthcare providers. And one of the major wins that has happened over the last few years is clinical documentation. In clinical documentation, they're using AI to help write notes during hospital visits. And so Kaiser Permanente used a bridge, which is an AI program, to help overhaul their clinical notes system. And currently 91% of notes are AI generated. And then there's another company, Nuance, that developed in partnership with Microsoft, Dragon Medical One, which is another program that has over 550,000 users. And it claims to attain a 50% time reduction in documentation times for their clients. And then in a real world example, Ottawa Hospital implemented an AI documentation system. And they said that it'll save them $11 million over the next 5 years. So this is an area where there is lots of gains, and there is lots of areas where it can continue to improve as well. Another area in the inpatient section is medical imaging. So AI is able to help image recognition and enhance diagnostic accuracy. Right there, so there's currently over 400 FDA-approved AI algorithms for medical imaging. This includes CT scans, MRIs, X-rays, and this is in real time to help detect critical findings faster than traditional methods. So the Mayo Clinic and other leading hospitals report 30% faster critical finding notifications, while they maintain their sensitivity rates for conditions. However, when it comes to actually diagnosing, there's AI is just not quite there yet, right? It has helped a lot on the imaging and pattern recognition, but when the AI itself is leaned upon to actually diagnose, there's been some mixed results, right? So Massachusetts General Hospital used this AI system that you can see on the left here to try and detect lung nodules for pulmonary embolisms, and they achieved 94% accuracy compared to 65% for just the human radiologists. But on the bad side, on the not quite there yet side, one of the current largest EMR providers, Epic Systems, they tried to implement a algorithm to help detect sepsis in patients by using the data that is put into their system. Except this system just continually warned and warned for sepsis, even when it was obvious it wasn't there. And so this caused alert fatigue for the healthcare providers, and they just started ignoring it, right? Because it wasn't accurate in any way. Another area that that can affect the inpatient experience for AI in healthcare is in pharmacy safety. And so AI powered pharmacy systems can dramatically reduce medication errors through automated dispensing, dosing verification, and allergy checking. Singapore General Hospital achieved 75% reduction in distribution errors, and Boston's Children's Hospital reduced pediatric dosing errors by 70%. By using AI powered pharmacy systems. And a specific company that does this is BD Roa. You can see one of their machines on the right there. They currently operate over 14,000 AI integrated dispensing robots. And these robots have a 99.99% uptime, meaning that they can constantly run. And they serve major hospital networks. The system processes millions of medications with near perfect accuracy, and this reduces the preparation time by 60% while completely eliminating human dispensing errors. So these are some of the ways that AI can help on the inpatient section, where patients are actually within the hospital. And next we'll explore what it could do on the administration side and cut the back end of the healthcare system.
Let's explore how AI is transforming healthcare administration. Artificial intelligence tools have incredible potential in this area, specifically in the ability to automate routine tasks and enhance office efficiency. This means that healthcare professionals can devote more time to patient care rather than administrative duties. One major benefit is improved data management. AI tools are excellent at handling vast amounts of data with accuracy and speed, which helps in keeping patient records up to date and easily accessible. Next, AI has the ability to analyze and optimize workflows. By analyzing and refining office processes, AI helps streamline operations, reduce bottlenecks, and improve the overall flow of work within a medical office. This results in more efficient healthcare delivery to patients. Finally, where AI really shines is the automation of administrative tasks. From scheduling to managing patient information, AI tools have the ability to take over repetitive tasks, which would allow healthcare staff and clinical staff to focus more on direct patient interactions. And this contributes to the overall goal of improving patient care and health outcomes. AI can significantly alleviate administrative burdens in healthcare by managing time-consuming tasks such as appointment scheduling, insurance verification, and billing. AI-driven scheduling tools that we are seeing crop up can help optimize appointment bookings, which will have the ability to reduce patient wait times and enhance office efficiency. Additionally, AI systems can help streamline insurance eligibility checks, which will allow the healthcare professionals to focus more on direct patient care. A notable application for AI is in patient charting, and where we are seeing this is that offices are utilizing ambient listening devices and generative AI tools to record and document patient encounters, recording only what is clinically relevant and within the patient encounter. And this improves note-taking speed and accuracy while minimizing human error, since it is not relying solely on human recall ability. And this also enhances healthcare quality and delivery. In summary, automating administrative tasks and streamlining charting with AI can transform healthcare processes, leading to better resource allocation and improved patient care and satisfaction. AI applications in revenue operations have the ability to significantly enhance medical billing and coding through through using historical data to refine procedure codes, streamlining billing and coding processes, and ensuring accurate patient-specific coding. This technology automated coding was once limited to large medical centers, but is now becoming accessible to healthcare offices of all sizes, mostly through AI tools. And this can help reduce administrative costs and allow the offices to focus on patient centered activities. Additionally, AI plays a vital role in supporting value based care through improved coding accuracy. Overall, AI promotes a more efficient, precise, and patient focused healthcare environment. One of the first places we are seeing AI applications currently is in medical billing and coding. And that makes sense because it can enhance accuracy and efficiency while alleviating staff burnout and optimizing revenue cycle management. Since this is an area that is highly rules based and repetitive, it is one of the easiest places to implement the technology. And some of the benefits that we see with this include improved coding workflows. AI recommends diagnosis codes based on clinical notes, which can streamline the process and reduce the burden on medical coders so that they are simply checking the work rather than having to track down the codes themselves. Automated reconciliation. AI can match diagnosis codes with procedure codes required by insurance, and this can improve billing accuracy and patient communication regarding non covered procedures. And finally, the auto adjudication of claims. This can help ensure that patients are charged appropriately and their refunds are accurate and handled promptly. And AI tools within an EHR also have the ability to handle routine billing inquiries from patients, which can also help enhance office efficiency. AI has the ability to transform health information management by enhancing efficiency and accuracy in several key areas. In streamlining patient records, AI can help automate routine records requests, allowing health records offices to focus on complex issues and improve the tracking of delinquent records. Risk management. AI is being implemented to provide predictive analytics to assess risks and forecast high risk patient events, which can help large hospitals prevent the risk events from occurring. Data automation. AI can help automate data entry and create standardized information sets, which can help ensure consistency across healthcare systems. And disease registries. And AI facilitates large scale data analysis for patient registries and can help utilize natural language processing to extract data from clinical notes and pathology reports. These advancements ultimately allow clinicians to concentrate more on patient care, fostering a more efficient and patient centered healthcare environment. One of the most immediate benefits of deploying AI in healthcare settings is the significant improvement in patient communication. With advancements in language learning models, automated phone systems can now handle many routine inquiries effectively. This change not only lightens the administrative load on front office staff, but also allows them to dedicate more time to personal patient support. AI-powered phone systems and chatbots excel at assisting patients with routine tasks and answering frequently asked questions, often natively within an EHR. This capability reduces wait times, which is key to enhancing patient satisfaction. Patients are able to have their questions answered without adding to the administrative load of the front office. AI-enabled patient engagement tools within an EHR can also provide improved patient education and support. This capability alone has decreased the number of emergency department visits by 35%, as well as decreasing the mortality rate for chronic disease patients by 45%. Improving office efficiency through AI isn't just about streamlining processes. It directly contributes to better patient outcomes. When the administrative side of an office runs smoothly, staff can focus their energies on delivering the best care, creating a more positive experience for everyone involved. Seeing AI through patients' eyes. As AI continues to transform healthcare, we often focus on what it can do: improve diagnostics, automate tasks, and increase efficiency. But there's a critical voice that often gets overlooked: The patients. It is important to focus on how patients perceive AI in their healthcare experiences. From AI powered chatbots in mental health to medication support for chronic conditions, we should examine where patients feel supported and where they feel alienated. These insights matter deeply because patient trust, comfort, and participation directly affect the success of AI tools in real world healthcare. What patients appreciate about AI. Patients are increasingly recognizing the benefits of AI in their care when it is implemented thoughtfully. In diagnostic contexts, AI can help reduce errors and speed up the process, which patients associate with safety and precision. In mental health, chatbots offer private 24/7 support, especially for people who might not have access to in person therapy due to stigma or cost. Kim et al. Found that users especially appreciated features like psychoeducational and emotional self management tools. For patients managing multiple chronic conditions, AI is useful for providing medication reminders, detecting potential drug interactions, and simplifying medication regimens. These reduce patient stress and improve adherence. Additionally, when AI is used to educate and empower patients, helping them understand their conditions and treatment choices, it fosters a greater sense of control and partnership in care. Patients' concerns and cautions. Despite the positives, patients also express significant concerns about the role of AI in their healthcare. A recurring theme is the loss of human connection, especially in emotional and complex care scenarios. Patients want to feel seen and heard, something AI still struggles to replicate. In the Good Luck study, participants worried about clinicians becoming too reliant on AI outputs, potentially leading to cold or robotic interactions. They emphasized the importance of empathy, which they felt could not be delivered by algorithms. Privacy and data transparency also surfaced as top concerns. Patients want to know who has access to their data and how it's being used. In the mental health context, Kim et al. Found that cost plays a major role in user engagement. Patients may turn to AI tools for affordability, but many are still cautious about paying for digital mental health services. What patients want in AI tools. What do patients want from AI healthcare? Across the studies, several consistent themes emerged. First, transparency. Patients want to understand how AI systems work, especially how they make decisions about diagnoses or treatment suggestions. Second, patients want AI that communicates with emotional sensitivity. They don't expect AI to quote unquote feel, but they do want it to recognize distress, offer reassurance, and not feel cold or mechanical. Third, data privacy and user control are essential. Patients want control over their information and assurance that it won't be misused. Fourth, accessibility. This includes both affordability and user friendly design. If patients can't afford to use an AI tool or if it's too complex, it defeats the purpose. Finally, patients were clear. AI should support human care, not replace it. They want AI to help doctors be more informed and efficient, not to remove the human touch from care entirely. Centering the patient in AI design. To build AI systems that truly serve patients, we need to go beyond functionality. We must design for trust, empathy, and equity. That starts with clear communication about what AI tools do and don't do. Patients are more likely to accept AI if they understand how it supports their care. AI should always enhance, not substitute, the role of clinicians. A study clearly showed that patients value the human relationship in healthcare, especially when they're vulnerable. Affordability and equity also can't be overlooked. If AI tools are only available to the privileged, They risk deepening health disparities. And finally, we must build ethical, emotionally intelligent AI tools, ones that respect patient autonomy, protect their data, and respond to their real world needs. The future of healthcare AI will be defined not just by its intelligence, but by how well it listens to and serves the people it's meant to help. I am Sullivan Nard, and I'm going to be speaking about the drawbacks of future use of AI. AI in healthcare has a number of disadvantages. If trained on non-representative data, it can reinforce biases and result in unfair treatment or incorrect diagnosis. Sensitive patient data raises privacy issues, particularly if it's not handled securely. AI can also lessen human error, which could lead to the omission of crucial clinical details. Additionally, an over-reliance on algorithms may damage trust and relationships between patients and clinicians. Finally, consistent, safe integration across healthcare systems is hampered by high implementation costs and a lack of uniform legislation. AI drawback themes: bias and iniquity, privacy and security risks, loss of human judgment, trust and relationship issues. These all I will go into a bit more thorough as the next slides happen. Next slide, Jonathan. So first, bias and inequity. Inequity. When systems are trained on non-representative data, bias and inequality in healthcare AI occur, producing unreliable outcomes for unrepresented groups. This can exacerbate already existing health inequities by leading to incorrect diagnosis or unfair treatment. Subnote here, healthcare is dependent on individual cases rather than a set of data points. Training AI with data may endanger the patient's health and recovery. So when systems are trained on non-representative data, when we're training this AI on a set of data points rather individual cases, it will be very hard to find the minuscule details that separate us human beings apart that AI might not be able to pick upon. Each appointment is so different from the other, as us humans are so uniquely built and made up. It is very hard to train an artificial intelligence to be able to cover all the minuscule details that representative data would aim to show. Next page, Jonathan. Privacy and security risks. Large volumes of private health data are necessary for AI systems to operate, which raises questions about how that data is shared, stored, and safeguarded. Cyber attacks, data breaches, or improper use by third parties could reveal sensitive data if it is not well secured. Such occurrences may result in identity theft, a decline in trust, or damage to the personal lives and reputations of patients. As we've seen every day, we get multiple text, emails of fraud, of data breaches, of password theft. This is definitely a problem, and we need to find solutions and bring in AI to healthcare when we're not totally secure of our data currently may not be the best result for us. Next page. Loss of human judgment. AI may overlook delicate clinical indicators, emotional signals, or particular patient conditions that a qualified professional would see, despite its rapid data analysis capabilities. Over-reliance on AI can weaken critical thinking, which could result in mistakes if the AI is mistaken or if human experience and intuition are needed. Overall care quality and responsiveness may suffer as a result. Just a little point I added here, the healthcare system may become less adaptable, less sympathetic, and more prone to mistakes in complex or uncommon situations that AI is ill-equipped to manage if human judgment is diminished or ignored. It's critical that medical professionals view AI as a supplement, not a substitute. And lastly, trust and relationship issues. Next page, Jonathan, sorry. Trust and relationship issues. If machines make judgments instead of humans, patients can feel less respected or heard. This can affect treatment results, lower patient happiness, and erode trust in healthcare. Furthermore, AI has the potential to
further undermine trust in the healthcare system and the technology if it is opaque or makes mistakes. With less and less distrust in the world, do we need machines caring for us at our most critical and desperate moments? As AI becomes increasingly integrated into healthcare, we must address the ethical implications that come with this powerful technology. Our definition as AI in healthcare refers to systems that mimic human intelligence to interpret data and make decisions, like detecting diseases from images or predicting patient outcomes. Our core ethical issues, our first one being privacy and data security. Patient data is extremely sensitive, and AI must uphold the same, if not higher, standards of confidentiality that already exists in the hospitals. Bias and fairness is our next point. AI trained on biased data can perpetuate or worsen health disparities, especially in underrepresented populations. Accountability is our next one. Who is responsible when AI makes a wrong diagnosis? If AI misdiagnoses a patient, who is legally and morally responsible? The developers, the doctor, or the institution? And our last one here is transparency. Many AI models operate as black boxes. We can't always explain why they make certain decisions, which erodes trusts. And then there's a quote, as Obermeyer and colleagues put it, healthcare AI raises questions not just of performance, but of equity, trust, and safety. That captures the heart of these ethical challenges. Let's look at a real example of AI ethics gone wrong, specifically racial bias in a US healthcare algorithm. A widely used algorithm was found to underestimate the health needs of Black patients. The algorithm was used in healthcare as a metric from the average person that would come into the clinic, using healthcare costs as a proxy for health status. This AI made a mistake in inadvertently assuming that less spending meant less needs. The impact of this means that Black patients receive fewer referrals for complex care than equally sick white patients. And how does the US healthcare system fix this issue? It's actually pretty simple if we look into it. The US healthcare system went back through the algorithm and fixed the way that the model reads patients. Instead of using healthcare costs as a proxy, they changed it to use direct measures. This simple fix reduced 84% of racial bias in AI within healthcare. Now that we've explored risks, let's weigh the broader pros and cons of AI in healthcare. Let's start with our pros. Efficiency. AI can vastly improve efficiency. It can read medical scans in seconds, which takes away from time spent, talked about earlier in this project, from the workers who are spending 70% of their days looking through all of their paperwork and documentation and all the things that are taking up time. Our second one is scalability. It increases accessibility. Think of AI chatbots that help rural patients triage symptoms. And finally, it offers personalized care. By analyzing vast data sets, it can tailor treatments to individuals. This allows for very quick and in-depth treatment plans that are tailored to the person that is looking for medical help. Let's move on to our cons. There are drawbacks. Algorithms can reflect bias, as we saw earlier in our case study about underrepresented Black population patients. There are serious privacy concerns around patient data being stored and shared improperly, which is one thing that AI needs to uphold, as mentioned in the first slide of ethics. And finally, dependence. An over-reliance on AI could erode the clinician's role in judgment and empathy. Bowderham, in an article written, writes, AI for health should be indeed designed and used in a way that represents human dignity, fundamental rights, and values. AI systems should not promote equity, fairness. AI systems should promote equity, fairness, inclusiveness, and accountability. This was written in 2024. Our major ethical takeaway is that AI can revolutionize care, but ethical design, transparency, and human oversight are essential to ensure justice, autonomy, and non-maleficence in healthcare. I want to thank you guys for coming to our presentation. As you can see, AI has many opportunities to improve our healthcare system, but it needs to be done in a way that respects patients and respects our data and is private and secure. If it is able to do these things, AI in healthcare has the opportunity to revolutionize our healthcare system, and create better outcomes for the institutions and the patients in our healthcare system. Thank you once again. Here are our references throughout our presentation. Um, Thank you.